Hi, I'm Louise, one of the nutritionists at Connolly's Red Mills, and today I'm delighted to be joined by Matt Chesworth, who is a consultant at Newmarket Equine Hospital. Thank you very much for joining me, Matt.
No, thank you. Yeah, hopefully we'll find it useful.
I'm sure we will. So the topic we wanted to discuss with you, Matt, was developmental orthopedic disorders or disease. It's a term that breeders no doubt will be familiar with, and I know it encompasses a huge number of conditions from fasciitis to OCD. But what actually is or are developmental orthopedic disorders?
Yeah, so as you say, it's a really broad term. It basically takes into account about 5 or 6 diseases, looking at chips in joints, so osteochondrosis dissecans, angular limb deformities. Also takes into account flexural deformities, where the foot can become sometimes more flexed than normal, and also things such as juvenile wobblers type syndrome. Ultimately, it's a group of diseases that happen after the foal's been born. So it affects their musculoskeletal system during their sort of growth period. And it doesn't include those things that can happen prior to birth, so congenital issues.
Okay. And how common are developmental orthopedic problems?
So they're really quite common. The whole group essentially is very difficult to study itself, but individual diseases have been studied more specifically. As a whole, we see an awful lot of developmental orthopedic disease in young growing stock. But the ones that have been studied more specifically, so the chips in joints, the OCD, we see one study looked at just under 2,000 thoroughbreds, and they had about 23% of those affected as yearlings. And then warm bloods, there was another study, a smaller study, found that 67% of those were affected as yearlings, and that reduced into the sort of 30s by the age of 3. So a huge amount of animals affected, really.
And you mentioned warm bloods and thoroughbreds there. Is it more common in certain breeds, or is it common across the board?
Yeah, definitely. So definitely in the thoroughbreds, warm bloods and standard breds are pretty heavily affected. And then the more sort of cold blood types, so the cobs, etc., will be much less affected in the up to sort of feral horses, where there's very little in those populations of OCD. So sort of 2.5% actually affected in the sort of cold bloods and feral horses.
Okay. And what about risk factors? I know it's a multifactorial disease. There's no one cause, but there's lots of different risk factors. Can you just chat a little bit about some of the common risk factors that you might encounter?
Yeah, definitely. So we see there's a few things that have been picked up on. More specifically, they've been studied in OCD. So we know a lot of the studies have been based around the chips that we see in joints, and we see issues with genetics. So we know it's linked to quite a lot of genetics in terms of a significant portion of the horse's sort of chromosome number are linked to OCD. So it's actually very difficult to pick out individual ones that will change that around. It's sort of up to 2/3 of their genetic material is linked with OCD in some way. Also, nutrition plays a big part. We have there's lots of suggestion that actually overfeeding these horses can be a big problem. Their change from a low feed to a very high nutritious feed can be a problem as well. And then trace elements are very important to have correct. They need to be on the right balanced feeds, essentially.
I suppose it's important for the mare also during pregnancy to be getting the right trace elements, so that's being passed to the foal.
Yeah, definitely. And we know copper's really one of the things that gets stored in the foal during gestation. and they struggle to get much copper out of the mare's milk after the fold. So, and copper is very important in the development of bones ultimately. So having that availability to early on is important there.
Yeah.
And
Yeah.
there's other sorry.
No, go ahead. Sorry.
There's other sort of trace elements that can affect that as well. So zinc, for example, is another thing that can influence the amount of copper.
And I suppose it's about balance, isn't it? If you get too much of one, that can sort of affect the level of absorption of the other. So it's it's quite a wide subject to look at, the trace element supplementation. And in terms of then treatment, so if you have got a foal or yearling that has a developmental problem, does the treatment really depend on A, what that problem is, B, how severe it is? How do you sort of assess that from a veterinary point of view?
Yeah, so the treatment-wise, they very much vary in terms of, obviously, early on, there's potential for some of these diseases to cure, sort of heal themselves. So there's certainly the smaller fragments in joints that we certainly monitor initially, and there's good suggestion that actually there's a good ability for foals to heal OCD lesions up to sort of 5 months in the hocks and up to 8 months or so in the stifles. So that would be certainly an early start. If there's no evidence of lameness, or there isn't any other reasons to intervene at that point, then rest and keeping nutrition correct and all those sorts of things, and reducing the amount of work are important. But ultimately, surgery is sometimes important to consider, to try and reduce the effects on the joint. So removing fragments, obviously, to avoid any detrimental effects in the joint, and then potentially for the growth plate issue, so the angular limb deformities, trying to correct those elements there, so to slow down or speed up the growth on one side of the leg to correct that balance.
And ultimately, I suppose the presence of these problems can affect the value of the horse. So would you be more concerned about certain problems if you were advising a trainer or a dressage rider about buying a foal or yearling? Would there be problems that you'd be more wary of, if you like, rather than others?
Yeah, definitely. And there's certainly size of issue. So we're talking back to OCD again. The size of the fragments makes a big factor in terms of whether they're going to cause a problem in the future. Some of the smaller defects that we sometimes see in the fetlocks can be, if it's just a defect on the X-ray and the fetlock, then those sorts of issues can potentially be left without investigation or any further work. But the value is obviously linked very closely with their athletic potential, and if we have any worries about their future potential, then that's where we start to worry. And it costs the industry a huge amount during those periods.
And what about farriers? How important are they in terms of managing and helping with these conditions?
Yeah, they're really important. I mean, especially with the flexural deformities, where the flexor tendons tend to sometimes can shorten, or certainly the bones grow faster than the flexor tendons. The farriers are really important there, and to try and maintain the foot at the right angle and trimming accordingly. And then also for the angular limb deformities, trying to rebalance the pressures on the growth plates is really important, and the farriers can do a very good job initially to try and balance those changes there.
Mm-hmm. And if a breeder does have a foal that has a developmental problem, when should they call the vet? Should you always call a vet in the early stages to have a look, or is it worth waiting and seeing? How best is it to get the vet involved?
Yeah, I think definitely foals generally get checked early on anyway, so that would be the first time that a vet has a good look at joints, etc., and can tell there's an imminent problem at that point. And then really after that, any time where there's any concerns over swellings of joints or the angle of a limb doesn't look quite right, and basically at any point that there's concern, it's worth having the foal checked, just to make sure that there's we're on the right tracks, and if x-rays need to be taken, then they can be done at that point.
And if you had then 3 sort of top tips or take-home messages that you would give to breeders about developmental problems, what would they be? Sorry to put you on the spot for that one, but
no, that's all right. So I think the first thing really would be to make sure that the nutrition's right. So we want the foals to go through a fairly balanced and avoid any big hikes in the nutrition during the feeding period. So they don't want to be turned out on lush grass during the sort of more vulnerable periods of their development. And certainly for the mare as well, to keep everything fairly consistent and make sure that those trace elements are there within the feed. Also, really to avoid any big changes in potential trauma to the joints or to the physis, or the growth plates. So try and avoid any long periods of stabling followed by turnout with the mare galloping around the field, etc. Because we do know trauma has a big part to play in the diseases. And then really the other thing would be to potentially think about genetics. If they're having consistent problems, then they could think about maybe looking at the stallion and trying to maybe look at a different stallion that may have less problems with their foals ultimately. That's
some really great practical advice, Matt. Thank you so much. And I think another important aspect for me is that teamwork. We mentioned the nutrition, we mentioned the farrier and the vet. All of us are here to support breeders to get the best out of their horses. So I suppose my message would be, don't hesitate to call any of the professionals out there if you're worried about things. So thank you very much, Matt. I know you're incredibly busy, and I really appreciate you taking the time out to speak to us. I'm sure lots of people are going to find our chat really useful, and we look forward to catching up with you again soon.
Thanks so much. Yeah, no problem.